Hi nurses. So let's talk about the treatment of hyperthyroidism. Yes, hyperthyroid state. So as we already discussed, T3, T4, thyroid hormones level is high, metabolic rate is high. Yes, body functioning is more. So now we have to control it. So hyperthyroid treatment we can divide into various categories. So the first is antithyroid drugs. Antithyroid drugs, PTU, propylthiouracil, and methimazole. So we have these two drugs. Which one we can prefer? So the quick acting drug is PTU. Methimazole have delayed effect, but both are, we can say, choice of drugs for hyperthyroid. Okay, these drugs are given according to the weight of a client, height of a client, so individualized dose is calculated. Correct. And what is the main side effect with these drugs? Agranulocytosis. These drugs lower the WBC count. So we teach the client to report any fever, sore throat, mouth sores. These signs indicate client has infection. ਤਾਂ ਆਪਾਂ client ਨੂੰ ਇਹ teach ਕਰਦੇ ਹਾਂ ਅਗਰ ਤੁਹਾਨੂੰ ਕੋਈ ਵੀ signs ਨੇ fever ਜਾਂ sore throat ਜਾਂ you have to report. All right. Okay, move to the second treatment category, radioactive iodine therapy. Yes, radioactive iodine, like we give the client oral solution of radioactive iodine. We can give low dose or high dose. If given high dose, we can hospitalize the client. If given low dose, given on outpatient basis. Okay, so client ne ek dose le li and now client is discharged. So now what we can teach the client? Stay away from children and pregnant females for up to 1 week. Use separate personal items, utensils, may use disposable because body secretions are radioactive. Correct. Separate bathroom. Twice flush the toilet. Yes, as urine is radioactive as well. Okay, and ਇਹ ਜਿਹੜੀ radioactive iodine therapy ਆ ਇਹਦਾ ਜਿਹੜਾ effect ਆ 3 months ਤੱਕ ਆਊਗਾ. So it has delayed effect. So for 3 months, client has to take anti-thyroid drugs as well. Yes. So 3 months ਤੱਕ client ਨੂੰ ਨਾਲ anti-thyroid drugs ਲੈਣੇ ਹੋਣਗੇ. And up to 3 months, therapeutic effect hoega of radioactive iodine therapy, and then this is how we can control the thyroid. Okay, and after this question, appa client no radioactive iodine therapy deti. Now after what? After the treatment completion and the therapeutic effect, now we have to replace thyroid for lifetime. Metabolic rate we need the normal level of thyroid, so we need to replace the hormone levothyroxine for the lifetime after that. Okay, ਇਹ ਆਪਾਂ ਤਾਂ choose ਕਰਦੇ ਹਾਂ treatment approach ਅਗਰ medications ਦੇ ਨਾਲ control ਨਹੀਂ ਹੋ ਰਿਹਾ, right? Okay, but this radioactive iodine should not be given to the pregnant females. Remember it. Okay, move to the third treatment plan for hyperthyroidism, thyroidectomy. Appa thyroid gland remove ਕਰਦੇ ਆ, maybe partial, maybe complete. Okay, ਜਦੋਂ ਵੀ ਅਸੀਂ thyroid gland remove ਕਰਨਾ ਆ, prior to that, give the client Lugol solution. What is the role of that? It will reduce the vascularity and it reduces the T3, T4. Yes. Thyroid gland is highly vascular organ. ताकि bleeding na ho jaye. So we have to reduce the vascularity. So we give Lugol's solution, and this is given with the straw to prevent teeth staining. Right? Okay, like a week before we can give the client, or maybe up to 10 days we can consider this. All right. Chalo ji, now we have to remove the thyroid gland. पर हुण इहदे च एक रिस्क हुंदा आ, समटाइम्स बाय मिस्टेक पैराथायरॉयड ग्लैंड रिमूव हो जाता है. And after the thyroidectomy, client develops tetany, choastic trosio signs, hypocalcemia sign and symptoms, or laryngospasm, that is airway obstruction. So agar client nu koi bhi hypocalcemia the signs are ya, immediately we need to give the client calcium gluconate, so consider it. और अगर बाय चांस पैराथायरॉयड रिमूव हो गया, इन forearm च subcutaneously implant कर दिया and it starts to function again, it may works. All right, and after thyroidectomy, so now the next surgery, right? Priority is airway. After the surgery, we follow ABC in the Nclex, so airway breathing is first priority after the surgery, right? And we have to make sure client the bedside tracheostomy honi chahiye hai, because agar koi airway obstruct ho gaya, so we have to use tracheostomy to maintain patent airway, right? And after thyroidectomy, for few days, hoarseness is expected. Usually hoarseness also indicates ke koi airway di problem hai, but after thyroidectomy, for just few days, hoarseness is expected finding. Correct. So these are the main points for thyroidectomy. All right.